In modern history, there has been no catastrophe of the magnitude and dimensions in Puerto Rico, such as the passing of Hurricanes Irma and Maria on September 2017. The 78 municipalities that make up the island's geography, with 3.4 million persons, suffered monumental damages. The energy and potable water infrastructure, communications, banking, commerce, as well as other important systems collapsed completely, with losses calculated in over $1,000 billion. Over 150,000 homes were totally or partially destroyed. Dozens of shelters were activated to serve thousands of families in need. In the midst of this unprecedented tragedy, hospitals throughout Puerto Rico were the only ones that kept their operations available to the population in an uninterrupted manner during the hurricanes. A human history of unsurpassable sacrifices and dedication that saw the commitment and dedication of the thousands of professionals, doctors, and health employees at a moment of extreme urgency in the history of our country. Never before has Puerto Rico experienced such a challenging yet moving and stimulating experience at the same time. Once it was known that the passage of Hurricane Maria through the island was imminent, all emergency protocols were activated. Hospital institutions organized their clinical and administrative groups to review the contingency plans and face the event. On the morning of September the 20th, 2017, Hurricane Maria entered through the southeast part of the island and remained on our territory for more than 12 hours. From early morning, under strong winds with gusts of over 200 miles per hour and heavy rain, there were countless heroic actions by many employees, doctors, and health professionals who risked their lives during the hurricane. Staff who did not hesitate to hold windows down while other co-workers secured them, crawling through the roofs under the fury of the wind, uncovering drains to prevent them from collapsing. Others were uncovering sewers to prevent flooding while maneuvering the complicated transfer of patients to safe places due to water leaks in clinical areas, corridors, and rooms. Providing emergency services to patients in critical situations and that required complicated transfers. Doctors and employees who risked their lives with their patients taking them to other hospitals. In the middle of the emergency, under the strong winds and rain, to save their lives. Professionals who, knowing that their homes were in flood zones, some with their families in danger due to the collapse of roofs and damage to their residences, continued to provide services to patients, while some managed to communicate with their relatives to ensure they were safe. In the absence of energy, human chains of employees were created in hospitals to take food to the patients in the different floors using the stairs. 12 hours lived during the passage of Hurricane Maria left a desolate panorama in all of Puerto Rico. Our hospitals, which are present in all moments of life, grew through their actions and key contributions in the first weeks of recovery after the passage of Hurricane Maria. More than 100,000 patients were attended in emergency rooms. More than 30,000 patients were admitted in the weeks following the hurricane, and more than 45,000 committed employees, many of them staying overnight in hospitals. Hospitals that mounted external tents with several stations in order to provide electricity to the community, allow people to charge their cell phones and plug in their devices to administer their respiratory care treatments. Others who organized shelters for families in surrounding communities, including people staying in hotels. Hospitals that mobilized their staff to the shelters to provide supplies to attend to the health situations there. That coordinated visits to elderly homes, bringing essential supplies, diapers, nutritional supplements, clothing, and solar lamps, among other goods. Distributing hot food made by chefs to bedridden patients. Our hospital institutions coordinated and organized distribution centers for tons of medical, surgical equipment donated by international organizations to Puerto Rico. Employees who cleared roads to give access to the facilities. Many hospitals offered patients who were discharged free transportation service to their homes. The examples of heroism and delivery of hospitals to attend before, during, and after the passage of Hurricane Maria to the people of Puerto Rico are countless. Likewise, solidarity among hospitals in Puerto Rico is an example of resilience. They continuously supported each other to ensure that health services and operations were maintained serving the community. Hospitals that supplied diesel and gasoline to other hospitals. The supplies were distributed among themselves as well as spare parts and equipment, and received patients from other hospitals to guarantee continuity of the services. The Puerto Rico Hospital Association was also ready for the emergency. We worked hand in hand with hospitals to help solve the needs that arose each day, and coordinated with the agencies of the government of Puerto Rico, the federal agencies, and the private companies all the necessary help. There were complex and emergency situations such as a shortage of oxygen and the availability of diesel. The intervention of the Puerto Rico Hospital Association was crucial. In addition, together with the American Hospital Association, Greater New York Hospital Association, and Accurity, we established a campaign that achieved the collection of over $1 million to help affected hospital employees to cover basic expenses of their families. The hospitals in Puerto Rico are always present in all the moments of your life. But it is in moments of crisis that we truly prove what we are capable of. Today, we recognize the high degree of professionalism, commitment, and dedication shown by all the employees, physicians, and health professionals of our hospitals, even in the most difficult and complicated moments. Puerto Rico hospitals are now more present than ever.